I thank the gentleman for yielding. I thank my colleagues for allowing me to just be a part of this discussion for a few minutes. You know, it's interesting as my colleague from Arizona is pointing out the differences between the U.S. system, the Canadian system, and the British system. And I think one of the things that you see there is in America you've got competition. So the hospitals are all working to improve their survival rates. If you get a certain type of disease or illness, you know, people will check the various performance rates by hospitals, by clinics as to where it's working. You know, this bill now is 1,000 pages. It's over 1,000. We just went through a massive cap and trade and tax bill. But, you know, I just open it up, and one of the things that people say, don't worry, there's still going to be improvement and competition to get excellence. You know what job I want? Start on page 40 or 84. I want to be the commissioner. The commissioner shall specify the benefits. The next page, the commissioner shall establish the following standards. You go to page 87. The commissioner shall establish a permissible range. If the state has entered into an arrangement satisfactory to the commissioner, page 88. The commissioner shall. The commissioner shall. I mean, it's like, and this is in 2 minutes of looking at this bill, and it's like, well, it looks like the commissioner knows what to do, and if the commissioner is going to do all of this, what's there left for me? It looks like the commissioner is going to take over my health care.
You're spelling that word right. It doesn't say czar.
I was thinking it sounds like a czar, and coming from Michigan, we've had enough of czars. We've had enough of car czars, you know, who are running our automobile industry, who are making decisions about which car company will survive, how they will survive, who will manage the companies, who will be on the board of directors, what dealers will survive. I mean, you know.
Hey, reclaim my time, gentlemen. We're talking about the President of the United States firing the President of General Motors. We got ourselves into the insurance business, into the banking business, and now healthcare, what is it, 20% of all of American business? And we're going to have this commissioner tell, we're going to take another 20%
let me just
the government's going to run?
The gentleman will yield for just 1 minute, and then I'll leave it again. But, you know, think about it. If the President believes that he can decide who should run General Motors, which is a decision that he made, enforce the replacement of the president of General Motors, taking the next step and telling each of us what kind of health care we're going to have, you know, what treatments we can have, what procedures we can have, and how much are going to be paid, how much the government is going to pay for each one of those, is fully within the realm of possibility, which is exactly where this bill goes.
I guess what the gentleman is saying is that if the bill passes, we better hope the commissioner is as smart as Peter Orszag.
What we're really seeing here is a continued erosion of the rights of individuals and the rights of states. You know, Michigan is a donor state in terms of transportation. What does that mean? It means since the inception of the national highway or the national gas tax, for every dollar that Michigan has sent to Washington, we've received 83 cents back. That hardly seems fair to me, especially when we're now #1 in unemployment. But think about it, it's an erosion. And when we get that money back, the federal government tells us how to spend it. The same thing happens with education. We send money here. Think about what's going to happen with health care. It's going to come here to Washington, and we are going to apportion it back to the states. Some states are going to do better than others, and it's going to be based not on, you know, it's not going to be based on population or those types of things. It's going to be based on the power of people in this chamber and the chamber down the hall as to who's got the most influence. And there's going to be donor states and, what are they, donees or whatever, beneficiaries, the ones that get more than the rest of us. Recipients. And, you know, that's no way to run a healthcare system. We will lose freedom, and this place will become the center of distributing money and distributing power back to groups around the country. This is what we're fighting for. We're fighting for freedom for individuals and for sovereignty back to the states. You know, I
yield.
I'm listening to your description of the bureaucracy in the UK and those kinds of things, and I've just been paging through this bill, and I think we all know, I think that it was last week that the majority leader said something like, if we had to depend on the people who read the bill to vote for it, we wouldn't have very many votes. And, you know, this is the first time I saw this bill about 15 minutes ago, and I'm just kind of paging through it. Yeah, I'll yield, yeah.
To hold up the quote. The quote by the majority leader is, if every member pledged to not vote for it if they hadn't read it in its entirety, I think we would have very few votes.
Yeah, and
so he apparently thinks we shouldn't read the bills.
Well, let me just read a couple of things. Here's a paragraph. I just open it up. You know, before we went through the commissioner shall, which says, okay, he shall do everything, and there's not going to be anything left for me. Listen to this paragraph. Changes in income as a percent of FPL. In the case that an individual's income expressed as a percentage of the federal poverty level for a family of the size involved for a plan year is expected in a manner specified by the commissioner to be significantly different from the income as so expressed used under subsection A, the commissioner shall establish rules requiring an individual to report, consistent with the mechanism established under paragraph 2, significant changes in such income, including significant change in family composition, to the commissioner, and requiring the substitution of such income for the income otherwise applicable.
Excuse me? What?
Think of how many bureaucrats it is going to take to interpret that paragraph. Then
how many bureaucrats can dance on the head of a pin, huh?
Yeah, and then it goes through, you know, they're going to do accountability, they're going to do ethics standards, accountability performance programs, and all of these things, federal bureaucrats. And guess what? The same people who wrote this bill, also, their last bill that they wrote was No Child Left Behind. Because it says that as they collect this information, now the secretary shall identify, you know, organizations that are enrolled in the program that have failed to significantly improve. Does that sound like No Child Left Behind? Like we have in the Department of Education. What do we have? We have people in the Department of Education who don't read anything, who don't know the schools in Ludington, Michigan, or Detroit, or Saginaw, or Ann Arbor in Michigan, and they're identifying them as failing schools. Now the federal government is going to go through the process of identifying failing hospitals, failing nursing homes, and failing those if they don't meet federal requirements. And it's going to take a lot more bureaucrats. But I think we ought to challenge the American people. Members of Congress may not read it, but they ought to read this thing and see if they understand whether this is going to improve their health care or make it worse. I think they will become ill reading this bill.
Is there a medicine to treat nausea?
Yes. And reclaiming my time, I just would suggest that of all of the 32 czars, do we have a czar that deals with this, the failing czar?
Well, actually,
the failing czar?
The czar in this one is now, I think they've recognized that the czar is not a very popular word. The czar in this bill is called a commissioner. All right, so I guess when you get to the 33rd, I guess we could only have 32 czars. Now we are starting to create commissioners, and we'll probably have 32 commissioners. And then we will have, what, grand leaders after that. But you know, I think we've topped out on czars.
I happen to remember that the aftermath of the czars was actually the Marxism that arrived with the Leninism and that period of time. And yes, the commissioners and the list of those people, language makes all the difference. But I would like to know how they identify the failing czar or the failing commissioner who would put that all in his own package. Pardon?
It's identified in here, how you will identify the failing czar, and with the corresponding rules and regulations that go with this that I'm sure will be written in plain English, because this is not.